Transforming social care at a local level means thinking through some fresh approaches to leadership. What seems to work best is an open and reflective culture, a willingness to hear what people say and a willingness to respond to what they expect.
It starts with listening, and then it starts with framing a picture and selling a vision and selling a story. The worst leadership for me is to constrain every innovation with too much governance, to put things in the way of why we can't do something, because we don't run that bit, because we can't keep control of this bit. And actually what you really need to do is take all the barriers down and remember that you're all serving one person.
Modern and effective leadership does appear to have its own particular identity.
From the leadership in local government, I think what I notice is where there are passionate leaders who are committed, can demonstrate that commitment, clear what they're trying to achieve, can convey that to both their customers and to their staff. There you begin to see organisations that can begin to make the changes.
But it is important to bridge the divide between ideas and action.
I think the trick in leadership, whether it's at a national level, at a regional level or a local level, is not just saying, it's this way, guys, this is what we're trying to achieve, but this is how we're going to do it. And unless leaders inspire and motivate, then my view is that that change will not happen at a local level.
Listening and taking on what local forums say is at the heart of understanding what matters in people's lives.
You can also say what's negative.
They must start recognising the power of the great people, because we are getting an extremely powerful set. And having a mouthpiece like this, it really does give us a voice, and that's what we need. A voice, not a number of voices, but a voice.
Sometimes, quite frankly, you feel too small to be noticed. This forum, I think, fills that gap, whereby you can inform upward. That's the biggest thing I see about it, really, to be honest, and to be taken notice of.
Are there any threads of advice that can support chief executives and local commissioners?
We have to start to create a market, bringing all sorts of people on board who haven't traditionally been associated with the care and support services, using creativity and skills. And we need to urgently engage with the public about what they're prepared to pay towards and what they're not, and what people think is a fair relationship with the state in that regard.
Drawing together people and organisations from different backgrounds is a challenge. So are there common strands that weave effective partnerships?
If you look at any successful organisation in the 21st century, they're successful because they're actually close to their customers, they're close to the people that are using their services, they're clear about what people want. So I think it's absolutely essential that modern social care services listen to people who are using those services and work with those people to create services which support them and maintain their independence.
It's not rocket science that people who feel engaged and active actually have a sense of well-being. They're going to stay healthy longer. I mean, what is the health service about? Is it about treating people who are sick or keeping them healthy longer? It's a bit of both, really.
What's essential is that we place service users at the centre of consultation and partnership.
Users of services are a fundamental partner in this whole process. 5 years ago, this was very much around organisational delivery. 5 years hence, what we're seeing now is greater person-centred services, and users of services, citizens, having an active say in the way they want services shaped around them. And indeed, they'll be leading the process in terms of having greater choice, actually determining the outcomes they want to meet, to make little changes or major changes to their own lives.
Vision, consultation and leadership are the keys to changing social care.
I don't think that putting people first can be delivered without active engagement with local people using services, their families, their carers and supporters, because after all we are seeking to put people first, and that's the only way that you're going to be able to do that.
Most new ideas, most new creative solutions, if you look over the last 2 or 3 decades, actually haven't come from government. They've come from initiatives that have come out of communities, come out of organisations, either local government itself, because it can innovate, or third sector organisations, partnerships in local communities, innovative people thinking through, usually engaging with customers or potential customers, coming up with solutions together that actually will meet people's needs and do it in new ways.
As individuals take control and begin to design and plan the services they want for themselves, what outcomes can we expect?
If you give you a view about what do you need to help you and improve the quality of life, two things happen. One, you're more frugal. Two, you're more creative, and it's more personal. So in that sense, you start to have a serious transformational shift, both of attitude, which is very important, but also of culture.
Transforming our care services is a process that involves us all.
This isn't a blueprint for a solution, it's a direction of travel. We're all on the direction of travel. We need to learn from each other as people go down different journeys to get the absolute best to create that society's vision that we want.